Hi, my name is Jason Wu. I am the Director of Operations here at the Human Services Council. Thank you so much for joining us today for this training on HSC's emergency planning tools. I would like to thank our wonderful presenters, Annie Grunwald and Rebecca Hansen, who will be leading this training today. As a note, everybody is currently muted and you will remain muted for the duration of this training. I also recommend that everybody stay off camera as we will be recording this and providing the PowerPoint and the video of this, as well as our planning template after the training itself. This is the second in a series of HSC's resiliency planning webinars that Annie and Rebecca have designed for us, and we are so happy to be able to share them with you today. So before we get started, I am going to put up a poll, and I would just like for everybody to please respond to the poll. As a note, at the end of the training, we will be happy to take any questions. If you do have questions as we're going through the slides, please feel free to put them into the chat. I will make sure we get to them. And also, when you leave the training, a survey will pop up, and please fill out the survey. The survey is really helpful for us as we continue planning future webinars and as we continue looking through our own emergency planning templates. And so without further ado, I'm just going to put up the poll. It's going to be up for just a few minutes. Please respond, and we will get started as soon as I close the poll. And this also gives people a chance to sign on as well. So for everybody new that has just joined us, you should have a poll up on your screen. Please just take a minute to respond. This is really helpful for us to help set the stage so that we know where people are starting at. For those of you who have joined us late, we are asking that everybody stay off camera. Everybody is currently muted. We are recording this. The slides will be shared. The video will be shared. The template was already shared and will be shared again after the training. When you leave the training, a survey will pop up on your on like a web page for you. Please fill it out. That will be really helpful for us as we continue planning these future webinars. Okay, so I'm going to leave it up for just another 30 seconds. So if you haven't had a chance to fill out the poll yet, please take a chance to do so. We are pretty close to getting 100% participation, which would be very exciting for me. And again, thank you everybody for joining us this morning. I know it's early and it's pretty early to be learning about disaster preparedness templates, but here we are. So thank you, everybody.
I'm offended, Jason, that you think this isn't what everybody wants to do at 9:30.
First thing in the morning. Absolutely. Absolutely. Okay, so I am going to end the poll in just another second. And thank you, everybody. Okay, so without further ado, welcome everybody. I would like to introduce you to Annie Grunwald and Rebecca Hansen, who will be leading our training today on resiliency planning and our emergency planning tools. Annie, please feel free to take it away.
Sure. Good morning, everyone. Such an impressive turnout this morning. So welcome again from myself and Rebecca, who you'll hear from a little bit later today. Rebecca and I, as you know, are the presenters for today, and we've also been working for many months with HSC on this new set of emergency planning resources for organizations that we'll be talking out and really delving into today. For those of you not familiar with the Human Services Council, it is a 170 member organization strong. It works closely with members to advocate for and foster collective action to really strengthen New York City's nonprofit human services sector as a whole. And for a small organization, does a great amount of work, has a number of initiatives, this disaster readiness and resilience program being just one of them. And part of that program are the webinars that we're offering and the materials that you'll learn about today. They also convene a work group to enhance collaboration around disaster planning for the sector and preparedness. And from time to time, we'll collaborate or produce related research efforts. So really spearheading efforts in this area for human services organizations. We could not do this, of course, without support. So a very special thanks to New York City Department of Health and Mental Hygiene and the Florence V. Burden Foundation for their tremendous support of the Readiness and Resilience program. So we thank them very much. Jumping right in just from the top first. So I want to just give you a high version of the tools, okay? So on the left side, this is what we're going to be talking about today. This a template. Oh, I'm going to pull my pointer up. The emergency management plan template, associated appendices, and a toolkit or instruction guide. And then we have these the resiliency planning webinar series that there are 4 planned for currently. We hope to have others as time goes on. The first webinar I'm going to talk about in just a moment. We're here at the emergency planning tools we're talking about today, delving into them. And the last 2 planned right now are really a topic, they're section specific of the plan, specific to certain areas in planning, and we'll point out how those correspond to sections in the plan as we go through. So let's just give you a little teaser. So for those of you who did not attend the first webinar, which was Anatomy of a Well Planned for Disaster. It was really designed to demonstrate the importance and the power of embracing emergency planning at your organizations, really seeing what the difference that investing time and energy into planning can make, and how having a strong emergency management program can really play out when you do need to respond and recover from events that inevitably happen. So what we did in this webinar is took you on a journey with the fictitious ABC and the fictitious logo as well, community center, as they first had a wake-up call during Hurricane Sandy, which was common to many of you, I'm sure. And they went through from having a plan that nobody really knew what was in it, to developing a comprehensive planning program. And then we saw as they reaped the benefits of that program, as they responded to a water main break, they were able to had some procedures for flash floods they were able to use. They had pre-identified their programs that they wanted to have the least disruption in. So we're able to continue operations during this several-month recovery, and then looked at what they did well, what they needed improvement, that then fed back into the plan. So that was the first webinar. You don't have to have seen it to understand this one about going through the programs, but we do encourage you, if you're a visual learner or you have folks that are new to emergency management, it gives a nice understanding without just going through kind of the dry definitions. We will go through a few dry definitions today, but this is a good sort of introduction to emergency planning, especially for human services organizations. The big takeaway from that, and really what we want to kind of push and hope folks can understand in all of these efforts, really the central message is that a plan that you have either on a shelf or on the cloud, wherever it may be, if it hasn't collected, if the whole organization hasn't collectively participated in creating it, it really is useless. So what we're encouraging folks, so we know that if that's the case, it really is not helpful. So we're looking for folks to go towards a plan, separate plan, to really building a comprehensive emergency management program that's embedded in existing systems in the organization, is client-focused, engages partners, with the plan just really being the receptacle of all the good work that the organization does. So that's all we're going to say about the last webinar, and we're going to jump into today's agenda. As I said, we're going to talk a little bit about terminology because we emergency managers love our lingo. Overview of the materials. We're going to give you kind of a bigger view of how we thought about creating these materials and what's there. And then we're going to just go through section by section so you have a sense of what's in each of the sections of the template. So we're going to start with all of these words. So there are many words to describe bad things that can happen to disrupt your organizations, and they all have definitions: crisis, emergency, disasters, usually looked at as larger and catastrophic. An incident, we often refer to disasters, emergencies, and crises. So what we just want to clarify is that they're often used interchangeably, and we use them interchangeably in the template unless they're specifically defined. So let me just give you an example of that. So we're going to be talking a lot about an emergency management program. And what we mean by that is not just, it doesn't just relate to emergencies, it's any kind of incident. And it consists of systems and structures and protocols that really facilitates an organization's ability to be resilient. And we're going to talk about these words: respond, recovery, prepare, and mitigate next. So those are often talked about as the phases of emergency management. So they are foundational. So we want to just review them quickly. Our kind of definitions of planning. That's sort of the phase when all the actions that you take during steady state, when there isn't something crazy happening, that improve your organization's resiliency, whatever it is. Meeting about the plan, it's doing an insurance update, it's doing some training, all of those actions. Often people will say that mitigation is a phase. We like to look at it as part of planning. They're often, when we talk about mitigation though, they're often structural. They're things that really reduce risks. So that could be, raising building systems, increasing insurance, fireproofing, those kinds of things. It doesn't matter what you call it. You just might engage in these actions if you see fit during the planning phase. The next phase, continuity, all those things that you do to improve your organization's ability to sustain programs during a disruption. So really making choices about which program, hopefully because you have done some planning in order to do that. Response, let's see, I'm not sure why. Different order, but response actually are all those actions triggered by an incident that keep people safe and property safe. So everything from evacuating or calling an ambulance, those are all response phase actions. Continuity we just looked at. And recovery really are all those actions that get you back to a steady state. Continuity isn't always looked at as a phase, but we think it's a very important one, that phase where you're really keeping programs going during significant disruptions. Now we just put it in a circle because the phases are often looked at as a cycle where one phase informs the other. And when we talked about the first webinar, you saw that circle as well, where all of the planning actions inform how you respond, which then informs how well you're able to keep your programs running, which informs recovery and then is all fed back into planning. Okay, so that's enough language for us today. If you want more of this, we do have one of the appendices is a terms document. So if we use something and you're not sure about it, you can find it in there. So the materials, excuse me. You all should have received a link. And if you didn't receive the link or can't find it, you can actually find it on the HSC website now. And the page you're directed to, the materials should look like this. So what I want to do is just kind of go through these groupings of materials first before we delve in a bit. So the first set, these are really organizational documents, and we're going to go through those. I'm going to show you those in a moment. The actual tools are these three sets. The template itself is we're calling it a draft because nothing is final in emergency management. So the template itself is about 28 pages. That's the body of the document. We also did a separate cover title page, a place where you can put revisions, and we'll look at a document like that in a moment, on there where you can list what your distribution list is, that kind of things. You can use it, or like all of this, if it's helpful, use it. If it isn't, don't. The next sort of category of documents is the appendices. And really, these either provide more detailed information about a section in the plan, or their forms, worksheets, templates, job aids, anything that can help you accomplish whatever that section is talking about. Most of them are together. So this right here has ones, I think there are 14 or 15 maybe of them, maybe more, and they're all together except for these three that are separate. And the only reason these are separate is that in order to manipulate them, these two of them are Excel spreadsheets, and one is a PowerPoint slide that provides a table of organization for an incident management team. So in order for you to manipulate them and actually use them, they are separate documents that you can use. And the last category is just one document, and that is the toolkit, which is really in instructions. All right, so now I'm going to just show you those two organizational documents right up here, just so you have a sense of what those look like. So just like we said, we included title pages for your templates that you can use. And one of those things that's there is a record of changes, because as you're doing your plan, as you change things, you want to make a record of that. So someone that picks up an old version can see what maybe is new about it, or they can see, oh, this is the correct version. Well, the same things with the template and the tools. We want this to be a continuous process. And so where we get feedback from you, we create additional resources. We adjust some of the resources that we've provided for you. And so this is really a record of changes for the tools. And you can always come back to this and see if anything has changed since the last time you've looked at documents. So this is really at a glance. And I like this because I'm a very visual person. And this allows you to see each of the types of tools and how they relate to each other. So what I want to point out first is that the template has 13 sections in it. That made sense to us. Might not make sense to you. You might combine some, or you might have it differently organized. But just to say that the template follows the same numbering as the toolkit. So if you're working on a section and you say, oh, I wonder if there's more guidance in the toolkit, you know, you're working on COOP, you can go to section 5 in the toolkit and find the instructions. Intuitive. What I also want to point out is that the appendices here, this just, remember we said they're mostly all together in one document. That's everything in the black typeface, but they're the ones in red are separate documents. But this just shows you which section they're associated with. So how many have tools associated with them. So that's what this does. This also shows you which webinars are associated with each section. They're just two. Remember we said the first two webinars, the one we're on now, are kind of big picture. The last one was big picture. These two are specific. We hope to have additional webinars that really focus on particular areas like COOP, that really delve into and this is where your feedback is really helpful to us to see what would be most helpful for you in those areas. All right. So now I want to point a couple things about how the sections are organized, and that is some of the sections. Remember we talked about the phases in the cycle. Some of the sections are really based on those phases. So they really focus on all the things, the actions that are relevant to that particular phase. So planning and preparedness, all the things that you do in planning and preparedness are included in that section in the document, as is emergency response, continuity, and recovery. There's not a separate mitigation section, because what we said is that you would just include that in your planning and preparedness. At least that's the way we like to look at it. What are the other sections based on, you may ask? Well, they're really topic based. So not based on a particular phase. They might inform all of the phases, such as communications. That's relevant in all of the phases, but we found it very helpful to really have these subject specific areas like human resources. Everything that relates to emergencies and human resources is in that section. So it's easier to find that information. Okay, so that's how it's organized. Now just a little bit more about how we thought about producing this. So you're going to look at this and say, this slide, and say, well, that is not true. One size does not fit all for human services organizations. And you are correct. You are a varied bunch, right? Different sizes, different clients, different structures, different subsectors. So we looked at this as, of course, one size is not going to fit everyone. So we're looking at it as more as one size fits most, with adjustments. So everything has to be adjustments, has to be adjusted to your organization. But we did look at some commonalities that many organizations have in common, and we wanted to make sure that we addressed those in the template. So those include direct service, that you provide direct service, multiple programs. How do you manage that in your plans, various program sites, clients with different needs, all of this. Not to say that if you don't have multiple, if you're just one program or you're an advocacy organization, you can adjust fairly easily to that. You're just cutting out a lot of the copy that you don't need. All right, and the last thing about the approach, which we really just talked about, is there's sample text, but organizations really have to edit it to fit their clients, stakeholders, culture, complexity, all of that. Our guiding principle was, let's get you in the middle. So have a medium to smallerish type of organization. But we thought, and what the feedback that we heard from, actually, I meant to mention some of you of the organizations that really participated in looking at a lot of these materials, that we so appreciated their feedback, in saying that it's easier to take away. So the blank page is hard for folks, especially on a topic that's something that you're not used to writing about. So we didn't want you to have that blank page. We start with copy. You're just going to need to take away and adjust. So before we go, one more thing. Principle. We just wanted to mention that, like all plans, all of these 13 sections are not mutually exclusive. You're going to have to make some decisions on where to put certain things. We gave you some sections that maybe you don't need all of them, but some of them might make sense to some people and some to the others. Case in point is that if you have a headquarters fire safety plan, maybe it's simple because you're in somebody else's building and it's just your admin staff. So maybe you'd put that right under emergency response in that section. Or maybe you still would want to keep that and others in your hazard specific plans and protocols. Or still maybe if your headquarters was large, you leased the building and you had a daycare center, on the first floor, that daycare center detailed plans might go in program specific plans. So the key is just decide where you want to do it and then just refer in other locations. All right, so with that, before we get to the template review, I do want to just pull up the plan. And show you what it looks like. Just a few things that I wanted to point out. We have various abilities in terms of using different programs. So I just wanted to show you a couple things that'll make it easier for folks to understand about it. It is this little, the view that I discovered maybe 5 or 6 years ago is that nice little navigation pane. And because this is an automatic table of contents that we have here, the pane is very useful. You're looking for a particular section, you can just kind of scroll down here and find it. The other thing, a couple things I wanted to point out. We are not going to be using the plan to talk about each individual parts because it's just too much copy. But I do want to show you in the very beginning, there is a how to use this template, covers much of the same material things that we talked about. It also mentions, we have a lot of places where there are red brackets, where you can do a search and replace organization name. I'd encourage you only to do that in the sections that you've already adjusted, so you're not lulled into the idea that, oh, our name is in the whole plan, so it's ours. The next thing I just wanted to point out is that this is an automatic table of contents. So everywhere that you see a little triangle, that's going to show up in the table of contents. So what you can do, any changes that you make in terms of maybe you make this section longer and it's going to end up on a different page, that will show up in the table of contents when you update it. Or say you wanted to change the name of this, purpose intro, I don't know, let's just say, all you would do is then go up to the table of contents. Oh, whoops, but first you'd have to make sure that you're still on that. There we go. Go up to the table of contents, update table, entire table, and then it should show that purpose as purpose intro now. So if you're not sure, don't be frightened of it. You can make all kinds of changes. You can take out headings. And if you might have somebody on your staff, if you're not so adept at Word, that can help you with the sort of the logistics of that. So that's all I'm going to say about the template in terms of looking at it. Now let's go back to our section by section review. first thing, I'm going to just talk about the forward and introduction for just a moment. The two things I want to point out in the forward and introduction is that it's very standard copy for this section. So the purpose and scope are fairly straightforward in here that you could pretty much use. The two sections I want to point out are the fact that it says it's an all hazards plan, but you also need to examine and incorporate specific hazards that your organization is most vulnerable to. And the best way really to do that is through a hazard vulnerability analysis. And I want to just talk a little bit about what that is. We don't have a webinar just on this right now, so I do want to show you the tool that we have. So hazard vulnerability analysis really is just a formal process of figuring out all the things that you're susceptible to, right? Direct and indirect impacts of these hazards that may have on your organization. It's pretty much location based, although if all of your facilities are in New York City, certainly the weather hazards are all going to be the same. You might have slight differences though in terms of your clientele. You might be worried about child abductions if you have a place where, like we mentioned, childcare, but not so much if in other sections. So the why is some hazards we said require specific actions that you need to take. And the results of your hazard vulnerability analysis can really guide your organization to the types of hazard specific plans you need, and also provides a context for all of your planning efforts, and really can help reduce your risk. So now let me just show you the tool. This is one of those that's separate. Remember we said some are Excel. This is one of those Excel spreadsheets. Down here, I just want to point out there are 4 tabs. This is the main tab. This, you may recognize this if you have health-based programs, because it's based on Kaiser Permanente hazard vulnerability tool, HVA. That's why we say HVA, easier to say. That was developed for hospitals and healthcare organizations. We changed it and adapted it significantly, specifically for human services organizations and specifically for New York City. So quickly, what this main sheet is that on the left side, it lists all of the hazards that you should consider. We pre-populated this for you in that we included all the things that you need to consider in New York City because of where we are and what we are. But we also added these in blue, the things you might want to consider as a human services organization. Some of you probably already have. This first tab, though, does talk about how you would identify the ones that you want to consider, just in case. Maybe you have a chapter in another state. The next column here, this is about probability. So really what all you do is figure out, well, what's the likelihood of this happening to me in New York City? And this is where you look at what has happened in the past. Has it happened before? How many times? And where you indicate a number. And in the instructions, it gives you some guidance on how to choose that number. It's not an exact science. It's really about sparking conversation about what you have and don't have and what you're afraid of might happen to your staff and programs. So then this whole section, you're looking at impacts. Well, if this thing happened, what would the impacts be? And this whole section looks at, well, how prepared are we currently to handle this particular hazard? And so you're assigning numbers to each of these, and then it automatically calculates a risk. Intrinsically, this number doesn't mean anything, but if it's on the higher side, and really if in relation to others, you have some that are very high, that means you need to put some focused attention in that hazard. And while you are going through this process, you really probably identified a lot of other general planning tasks that you needed to do, which is why we included this planning notes section. Okay, so covered that. Quickly want to just mention the other piece in the forward and introduction is there's a whole section for organization information. And this isn't the stuff that's on your website or maybe even what you include in proposals for funding, but it could be some of it. It's really what's going to be useful to you during an operation, during response, mostly during sort of continuity and recovery. So we produced just a sample. We took an average organization, and in the toolkit, we have some sample copy for you. So for this particular organization, we thought you have the legal name and mission. You want to indicate something about your size and stakeholders, something about your program activities, and something about your locations, really giving a sense of what you do. So everybody has a big picture. Now, if you had 20 locations or 30 locations, you're not going to list them here. You probably send us to somewhere else in your plan where you list all the locations. You might have a pre-populated map of those locations. So whatever is going to be helpful for you is what you want to put here. All right. I have talked enough. And so now I'm going to welcome my colleague, Rebecca Hansen, to continue through all of the sections of the plan for you.
Great. Thank you, Annie. Okay, so we're going to just walk through the remaining 12 sections and hit on some of the highlights from each of those. And I just want to point out, in planning and preparedness, that's the first one we'll talk about, which is section 2 of the template. We are going to have a whole webinar really focus on this phase. So how do you as an organization really do planning and preparedness? How do you make this part of your organizational culture? How do you kind of change the way you do it from, maybe addressing it every once in a while when something happens or, something new comes up, and really transition to a more like regular, organic kind of way of building your plans and doing the planning process. So we're going to touch on all that in the next webinar. But for today, just to go over a little bit about what's in this section. I mean, in this part of the template, you're going to put everything you do as an organization to plan and prepare for emergencies. So what we do is, in the template and in the toolkit, we provide some tools to support you in developing this section. One of those talks about having a planning committee and how that can be really helpful in order to kind of keep the momentum going through the months and the days and the years ahead, right? And setting up a process and how that can be really helpful. So we're going to look in a minute at the tool that we've developed to support you in that, but just the idea that maybe taking a step back, looking at maybe every year, what are the things you want to accomplish in that year in terms of your emergency preparedness? What kind of things do you want to address? What do you want to develop? And then, make a plan for that. And so that, it's really about taking these small bites so that as you continue to do it over the months, over the years, you really start to develop a more robust plan. Part of what's also included in this section is any kinds of partnerships and collaborations in regard to emergency planning that you do. So in the Appendix 3, we've made a list for you of New York City COADs, community organizations active in disaster, of long-term recovery groups that are existing, of CERT teams that are existing, and other resources that you can take a look at. Maybe some of you are already part of that, and some of you might be interested in joining other groups and finding out more about that. Really important as part of your planning and preparedness. And in this section, you want to include any kind of training, any kind of exercises that you do in order to prepare your organization. So we've also provided a worksheet there. So sort of similar, you take a look at the beginning of the year and look, what are the training we want to hold this year? Who do we want to train on our staff? What do we want to train them on? What parts of the plan are we most concerned about? We want to make sure people understand it. And then exercising it. You know, maybe you've been working on a new notification system for staff, and you write up the procedures in the plan, and then you want to test it and see how it works and make adjustments as you go along to the plan. So all of that stuff could be in this section as well as just, you know, how are you going to keep evaluating your process after exercises, after events happen, so you can really learn from those experiences and build them into your planning process as you go forward. Another key thing is just personal preparedness, making sure that your staff have the materials and information they need to be prepared in the workplace, but also prepared at home. And Ready New York has tons of great information on that you can use. Don't need to change a thing. Appendix 7 is a tool to really just support your organization in doing emergency planning. It's a spreadsheet, it has multiple sheets. I'm just showing you 2 on the slide here. And what the first part is really just like in section A, okay, we want to this year talk about, we want to develop our continuity of operations section. We want to work on our communications plan. So you could put that on the chart. And then you might say, you know what, we really need to look at recovery, but we're probably not going to get to that till next year. Well, let's just put it on the chart, and then you can indicate when you'll get to that. And you can just use this chart to kind of just keep track of things, figure out who's responsible, the timing, what's high priority, low priority, right? You can just use this to just manage the planning process. That's all it really is. And then section 3 of the plan, we go into how your organization will manage the incident. So you have your planning phase, like Annie talked about. Then you have emergency response, where you take those emergency actions, and we'll talk about that in a minute. And then as you really get those kinds of things, you evacuate or you make notifications, you start moving into the new thing, a new phase where your team comes together to really figure out, all right, how are we going to deal with this emergency? And so what we've included in this section to help you develop it is a model for a team that can be brought together to move through the response, the continuity, and the recovery phases, and determine how your organization will respond. We include things in this section like how you activate that team, when that team holds meetings through the phases, maybe more often at first, and then they get a little bit less frequent. So we have some great models in there for you to take a look at. I want to show you on the next slide. This is a chart that we include in the, where do we include this? In the appendices. And it's really just a sample. And if you kind of think of it as for each of the boxes, could be a different individual's position. But what is important here is that they each kind of represent a different function that you need to think about in an emergency. If it's one thing we can do, it's like learn from our past emergencies. And we've learned that things kind of organize in these boxes here. So your programs, and we've really adjusted this for social service agencies, but you have a safety officer and a liaison officer. You have somebody who's focused on finance and administration. You have somebody who's really focused on the programs. And so if you have a small organization, a lot of these might kind of combine and go under one person who's responsible. But the important thing here is really to think about all these different functions and things that are happening in an emergency and pay attention to them. And so, we offer this, and this can be adjusted as you need. as it fits with your organization, or not use it all and you figure out something totally different. Okay.
I'm just going to add that in the next one of the other trainings is incident management. And so we're going to try and offer some alternative visions of this too during that. Like if you're in advocacy, what might this look like?
Great. Okay, so we go into emergency preparedness, right? And then we go to the next phase, which is the emergency response. That's what, as Annie said, is those things you do immediately to get safe, to take care of different things that need to be in the building, need to be taken care of. And that's what's really included in this section. Any of those building response plans, the structure that you might be using at your organization to manage in the immediate response. So a lot of times people might have a site emergency lead. They might have fire wardens. Some of these things might be familiar to you. All of that's included in here, and it's location specific. So you may have, if you have multiple sites, you may have 3 different emergency response plans or fire response plans that you are including in this section. It includes emergency procedures. It talks about how you work with the building owner and manager to manage that response and to make decisions very quickly when something happens. Okay, let's just move on. So now we've moved from emergency response, we bring our incident management team together and we start looking at, well, how can we continue our services even with all this stuff happening, with this emergency that's been going on, with this impact we've had to our organization or our facility. And so this part of the plan is where we really try to provide tools to help you think through what are your essential services, how do you want to prioritize all the services you have, and really pinpoint which ones, no matter what, you want to really try to continue even if an emergency happens. There may be some that, you can kind of let them go for a couple days. They're not as important, where like if you have a crisis service or a hotline or something like that, that might be something that is, you really don't want any disruption to. So what we've done is we provided these tools to try to help you figure that out. And I'm going to show you the next slide, the worksheet. This is a sample that is in the toolkit. And what it is we've taken an organization, just kind of a fake organization, let's call it ABC organization, as we did in the first webinar. And you lay in section B on the chart, you see all of the different services that the organization carries out. So telephone reassurance, meals, the grandparents program, their arts and dance classes. And what this organization has done is gone through and using some of the guidance that we've provided and the tools that we have in this, they've been able to prioritize, okay, our telephone reassurance, that is a top priority for us. We want to keep that going no matter what's happening at our organization. We're going to really put all our resources towards that to make sure that can keep going. However, our arts and dance classes, you know what, that's a C priority. That's not really, like, if we need to kind of suspend those services for a little while, that program for a little while, we're going to do that in favor of making sure the telephone reassurance program is going. So that's what this chart is for, to really help you take a good look at all of your services and then figure out what your priorities are when something happens. Section 6 of the template is all about communication. So anything that has to do about communications is included here, and how in an emergency you communicate with all your different stakeholders. That may be your staff, your clients, that may be your partners, your vendors, your board, and how do you make sure communication happens when an emergency is going on. And so some of the tools we've developed for that is a contact list chart, which helps you gather all the different contact lists you have in your organization, list them all on one chart, identify who's responsible for maintaining that, and where you can find that in emergency. Another thing that's really important is thinking through all the different methods you have for communicating. So if we go to the next slide, we've provided you in the appendices, just a chart you can use to start organizing and thinking through all the different ways that you communicate and how, for different stakeholders, you are going to really focus that communication methodology for. So if we look on the left side under communication method, you see there it says the main phone system, it says personal cell phones, a staff emergency line, a notification system. These are all different ways you might communicate with different stakeholders. So you would just list in the next column which stakeholders do you communicate in that way and how you access that, what are the procedures for using that. So if you have a staff notification line, how do you activate that? Who has the authority to do that? When will that be activated? And so you start to figure out all those kinds of things about it. And really also thinking about what's the primary way of communicating, and then what is some of our backup ways of communicating when maybe our primary way is not available because of whatever's happening, the emergency or whatever's happening. So this is another tool we provided to kind of help you through think through some of these things. We have then another section called facilities. And this here is where you would include really everything about any kind of spaces you have as an organization and try to pull it in and bring it into one place so that it's easy to access it and to kind of get a big picture of what's happening. Some of your spaces may be leased or rented. Some may be spaces that you own or you manage. And depending on which one it is, you'll have different responsibilities. So if you're renting a space, you might want to be just including making sure you understand who the building manager is and what they have planned in terms of emergency response, what their plans are, and how do you communicate with them in an emergency, because they'll be the ones making the decisions in that response phase. If you own or manage the facility, you're the one that is running that building plan. You're the one making the decisions, and you are the one responsible for all the building systems, for making sure that the water's running, the power's running, right? And figuring out what you're going to do during a response. So both of those are a little bit different. You just want to make sure you include that in this section of the plan. If you have a residential facility that you run, there's additional things that you may want to include in this section about maybe as part of your preparedness, you pre-identify tenants who have disabilities or different illnesses that require them to have additional support in an emergency. Maybe they need evacuation assistance. And so you keep a list of these kinds of tenants and what their needs would be. Any kinds of evacuation procedures that you have for that facility, you want to bring it in. Now, Annie mentioned, there is that section 4 that I talked about, the response section. You might keep some of the plans in that section. You might keep some of the plans in this section. And then later, we're even going to see there's another section you might keep them in. Only put them in one section and you just refer to them in the other sections. These things overlap, everything's interconnected. So you just want to be careful about just having things in one place and then referring to it in other areas of the plan. Okay. There's a section on emergency supplies and equipment. This is really for just keep track, include how you keep track of your normal supplies. If you purchase emergency supplies and equipment, put the information in there about that, including vendors that you work with. Human resources, I think when you think about COVID, I'm sure you all have made some policy decisions and changes in terms of in terms of HR, telework kinds of things, or maybe you've had hazard pay, or maybe you've had to adjust your sick leave policies. So that's the kind of thing you're thinking about in this section. What kinds of things, how do things alter when there's an emergency at hand? And also we want to point out, it's very important to think about how you're going to support your staff, the stress, and just give them mental health support, maybe through EAP programs, and maybe bringing in some counselors also to support them. Your IT section of your plan is really just everything IT, like how many computers do you have? What are the software that you use? What are the licenses? How do people access it? Who do you use to manage your IT? All of this gets pulled into this section so you can have it in one place and refer to it pretty easily. If you have procedures for how you recover backups, how you work remotely, all of that can be part of this section. In the toolkit, if you go to the next slide, we have another chart to just kind of help you think through the process and pull that information together. This is for vital records. And so you see in the second column, we've listed some suggested types of vital records, and you would just bring them all here into this chart and look at who's responsible, where they're located, so that in an emergency, you can easily access those records if you need to. Section 11, as we work through those phases, we get to the recovery phase. So anything having to do with, bringing your organization back to restoring your services, to communicating with people on different changes that are happening, how your IMT is transitioning maybe to a recovery team instead, how you're returning to your facility, all of these kinds of things would be included in your recovery section. And we've included just some things to kind of help you get started in that section. Financial resiliency, really important, how you're going to document your expenditures, how you're going to document costs and things like that during an emergency, whether you have a reserve funds, your insurance policies, all these things get pulled into this section as well so that you can refer to them and make sure you have things in place to support your organization financially during an emergency. And then finally, the last section is the hazard and program specific plans. I was kind of referring to this before when I said you might want to put just all your different building plans in this section. You may also, if you have a separate plan, as Annie talked about, you might need to have a separate plan for coastal storms versus an active shooter, right? You might have some procedures or things that are really particular to that organization. And if that's the case, you can put those here. I mean, it's really up to you, how you plan, how you organize this, but we put some suggestions here for you to think about. And so again, that kind of wraps up, the kind of high level review of the template that you have that will be available on the HSC website, which is available. You did receive that link, I believe. We had the first webinar, and that really, as Annie mentioned, went through a whole disaster scenario and how an organization got through that and how their planning really benefited them as they went through that. We have today's, which is a high level review of the tools. The third webinar is going to be all about how to do preparedness, how to bring a preparedness culture into your organization. And then the fourth one will be on incident management, on how you want to organize your organization to really be able to address all the different things that occur during an emergency in the best way possible. So we'll be talking about that. But we figured, we've given you so much information. There's a lot of tools, a lot of charts. So where do you start, right? And we just wanted to give you a couple of our tips for how you can get started, kind of moving through this process. The first thing, and what we always see, is just getting that leadership buy-in is so important. That's really why in that first webinar, we really focus on what are the benefits of planning and how to communicate those benefits. Because once you get everyone's buy-in, that's when you begin to see that this can really be part of your everyday work experience and of your culture. Establish a planning team. I mean, this can be just a couple people. Or it could be, 10 different people who are from different programs and from different areas of the organization who can bring their perspectives in to figure out what are the planning priorities? What do you guys want to test? What do you really want to develop? What hazards do you want to focus on? And bring that team together, and then just look at the webinars, start reviewing them together, move to the next slide. And we talk about making sure that you just take some time to look at the plans you have, look at the procedures you have. You probably have more things than you think that you can pull into your emergency plan. Look at the tools we provide and just get familiar with them. And then once you've kind of done those things, you can start really diving in. And one of the best places to do that is really just start with that hazard vulnerability analysis. Annie showed you the tool we provided. And this is a good way to just start looking at what is the thing that keeps me up at night? What am I most worried about in our organization? What are we most vulnerable to? And just start your planning there. Then our final tip that we'll give you, because we don't want to get too long on our tips either, is just start working from sections 1 to 6 in the template. And if you just little by little build on each of these sections, you'll have a really strong foundation for your plan, and you can start, working on those other sections as you go along. But, think of this as a long-term process. So every month, every year, you're making progress, you're building that plan. And over doing that over a couple of years, you will end up having a really robust plan that is really helpful in an emergency. And so we just really encourage you to do that, but understand that it's step by step. So we're going to leave you at that. Hopefully this information has been helpful and helps you understand the tools that are available to you. We are so excited to hear your feedback, to hear how these tools are landing for you, to hear any other input you have, about things that we could address in the future and future webinars or in tools and things like that. Please provide your feedback to any of us, or you can just simply email info@humanservicescouncil.org. And we just really encourage you to contact us and let us know how it's going. Thanks so much for participating today, and good luck with your planning.
Thank you so much, Rebecca and Annie. That was a wonderful presentation. So now that we've reached the end of the official presentation, we are happy to take any questions that you might have, either in the chat, or if you want to unmute yourselves, come back on video, you are free to do so. So I have gotten a couple of questions. Everybody will be receiving the PowerPoint slides. I will also be sharing the recording. And the template is already up on our website. It's in draft form because we are always looking to improve upon it. When you leave the meeting today, you should get a pop-up on your browser with a survey that's going to ask for some of your feedback on the presentation today. We would absolutely love to hear from you. Yes, so does anybody have any questions they would like to ask about anything that's been presented today? Oh, and I forgot to mention, everybody that attended today's webinar will also be receiving information from the first webinar as well. So not to worry, I will make sure to send it out to everybody. Any questions? Don't be shy.
I don't see any in the chat. Excellent. Yes. The important thing, as Becky said, is you probably have a lot of stuff that you can start putting into different sections. The other thing, as she said in that first webinar, is that we're going to really be looking at how you can approach it from different sides. Don't have buy-in. Well, you can still start somewhere. So those kinds of tips we'll be able to provide in the next webinar. I think that's it, Jason. I don't see.
Okay.
Reach out if you think of something.